Hey y'all, Dr. T. It's been a while. I think with the holidays and everything that's been going on in the world, it's just I didn't get around to getting back on for a live. So I thought I'd get on right now and just kind of see if anybody's got any questions. I posted a story a while back, actually yesterday. Was it yesterday? Yeah, I got the vaccine and it's been mostly good feedback from everybody. I appreciate the support and kindness, and not a lot of negativity about it. We all have reasons for doing it or not doing it. But I just wanted to see if there was any questions about the vaccine, if there were any questions about hormones or fibroids, Essure removal. As we move into the new year, a lot of things are going to be happening in 2021. I'm actually moving over to a different platform called Clubhouse. Shawn Tassone, MD, on Clubhouse, and Clubhouse is going to allow me to do a lot more Q&As, kind of like live Q&As with people. So if you don't have a Clubhouse account and you want to grab one, it'd be kind of cool. It's free. And then, you can listen to me interview people and do some cool stuff. Melissa says, I already had COVID. I'm diabetic. Should I get the vaccine? I mean, I can't give medical advice to you, Melissa, because you're not a patient. There is, looking at the theory behind it. If you've had COVID, theoretically, you should have COVID antibodies. And you could always check your antibody levels and see what they are. Being diabetic adds a different layer to that because you might be slightly immunocompromised being diabetic, especially if your levels aren't well controlled. I don't think you're ever wrong for doing it if you wanted to make doubly sure that you were covered. I know there's a lot of question on the side effects of the actual vaccine, and you can look those up. Basically, for me, had a little bit of dizziness, had some shoulder pain that's still pretty prevalent, consistent with other vaccines that I've gotten. Maybe even have a little bit of fatigue and just kind of feeling like I have a little bit of brain fog, but nothing massive. And who knows, I might have brain fog all the time because I'm so old. But it's just one of those things. I think, you can decide for yourself. A lot of people are waiting to just see what the side effect profile is for a lot of people, see what the reported side effects are. So obviously waiting, and just keeping yourself safe. I just started having a reaction to my white gold wedding ring. Do you think this is related to Essure? So Essure, it has no gold in it, obviously. It's titanium, stainless steel, and polyethyl terephthalate, nickel, some other things. I don't think it would be related. However, maybe related in the sense that you have allergies to metals. And so, if you're allergic to white gold, you might have an allergy to nickel or titanium or stainless steel. So, and the only way to really know if you have an issue with your Essure is to have it removed. And you don't need a specific reason to have Essure removed. The simple fact that you want it out is enough to just have it removed. So you don't have to search for specific reasons. So as far as if you don't have medical insurance, that makes it difficult. Medicaid will remove it. Medicare will remove it. So if you can somehow get on any state insurance, that would definitely be helpful as well. What else? Any questions? Hormones, the virus vaccine, the hormone related, fibroid related, what the hell I'm doing in 2021 related, because I got a lot of plans this year. Like I said, I'm switching over to Clubhouse, so I'm going to do a lot of things. I'm going to start interviewing people, going to start doing some really kind of discussion-oriented things on Clubhouse. So if you don't have the Clubhouse app, go get it. And if it's free, if you do, I'm just Shawn Tassone, MD. give me a follow. I'm going to start doing some clubhouse discussions with some of my friends. And my best friend, Nat Kringoudis, we're going to do some hormone discussions. Hey, Dr. T, hope you have a Merry Christmas and hope you have an amazing New Year. It's going to be a good New Year, and I'll tell you why. January, revising my website and doing some new classes online that I'm going to have. One is going to be called the Shines Protocol. It's how to deal with hormone imbalances with spiritual practices, hormones, information, energetic transmission, nutrition, exercise, and supplement. I'm going to have a lot of new things on the website, and I'm also going to be finishing the book. The book is pretty much done. Second round of edits, the Hormone Balance Bible. You can get it on Amazon right now. However, it's not going to be officially published until July. And for the next 6 months, I'm going to be in book launch mode. So any information y'all can give me, any things you want to hear about with hormones, I'm going to have a bunch of new blog posts. Going to talking about estrogen dominance, estrogen deprivation, progesterone, testosterone excess and deprivation, cortisol excess and deprivation, hypothyroidism, hyperthyroidism, and combinations of these problems. So all kinds of things over the next 6 months. You're just going to get inundated with hopefully information that you want to hear, that you like. I am never one to shy away from a conflict. So like I did with yesterday with getting the vaccine, obviously there were, not everybody's in support of that, and I get that. Had somebody kind of giving me a little bit of flack saying she couldn't trust me anymore because I got the vaccine, which, if you think about it, is pretty ridiculous that you would completely throw the baby out with the bathwater just because you didn't agree with one thing that somebody said. But that's what basically we have in this country right now, are people that are so black or white they can't see the forest through the trees. And to think that you are right means that somebody else is wrong. And here's the deal. Ken Wilber, and I'm going to get philosophical. I'm going to wax philosophical. Ken Wilber, an American philosopher, has this theory he calls the pre-trans fallacy. And I'm not going to do it justice, but the pre-trans fallacy means that, let's say you have two sides on a subject. You have, Leslie, what's your question about that? You have, let's say for spirituality or for religion, you have people that believe in religion, and you have people that believe in, or God, and you have people that believe in science. Different ends of the spectrum. So basically they would say all of the brain's functions, the scientists would say, all of the brain's functions come down to chemicals. Chemical imbalances, neurons, electricity. It's very scientific. There's absolutely no supernatural to it. The religious side would say it's all God. It's all preordained. It's all religion. Both of those things in this universe, they can't be right, correct? You can't have both of those views be correct, because that means one is totally wrong. So this is the problem. They both think that they're right when they both can't be right. But it's not physically possible. The possibility then resides in the fact that it has to be some sort of an amalgamation of those two things. And it's the same thing with vaccines. You can't have it's all evil or it's all good. There has to be side effects. There has to be good outcomes. And I will say this, and I said this yesterday, the reason that the generation below me, the 30-year-olds, the 20-year-olds, have probably never even heard of smallpox is because our generation got vaccinated and the generation before. So you take it for granted that you live in this society where there's no disease. But there's no disease, or there's very little disease, polio, and smallpox, because it got eradicated because we got vaccinated. I mean, you can't doubt that. That's just facts. Thank you, Donna. No, vaccines. Well, it depends on what you're. So here's the problem. The definition of holistic means you're thinking about the whole person. So sure, it could be holistic in the sense that you think about the immune system, you think about the side effect profile, you think about the person's allergies. There's all kinds of reasons. Holism, it doesn't mean. I think the problem is the allopaths dig their feet in and the holistic people dig their feet in. And again, the pre-trans fallacy. Nothing can be purely allopathic and nothing can be purely alternative. It has to be a blend. And the problem is you have the allopaths digging in because you have all these people out there that are attacking them that think they know better, even though they have absolutely no education. They are, they took a weekend course or a 6-month course and they put out there that they're experts, or you even have doctors who trained in some other field like ER, and they're wonderful at doing heart attacks and stuff, but then they all of a sudden claim they're like a women's health expert or fertility or whatever. It doesn't work that way. You can't claim expertise when you haven't done it, when you've gone to a weekend course. And that's what's happening. And so the allopaths get upset, and then what they do is they shut out the alternative med practitioners because that's just tit for tat, as it were. How to reverse... I've been struggling for 16 years, diagnosed with it, and I also have PCOS. How to reverse is? What are we reversing? Oh, if you have endometrial hyperplasia without atypia, you can do at times a trial of progesterone therapy and rebiopsy in a few months to see if it reverses. I would prefer first to do a dilation curettage or a DNC, just to make sure that there wasn't like a foci or a focus of atypia or endometrial cancer before I just tried some sort of alternative therapies. If you've had the DNC and a hysteroscopy where they looked with a camera in the uterus, then yeah, by all means, under the direct supervision of the person that's working with you, try some progesterone therapy or things like that. And you can always work on inflammation. Hey, Anna Vu Wallace is one of the premier hospital physicians here in Austin. She's been an advocate for health and COVID, and she's a frontliner who has seen a lot of things here in Austin. And I wouldn't say Austin right now is a hotbed. She might debate that with me compared to other places. But she's on the front lines, and she's putting her life at risk every day. And I think we take it for granted that there's doctors and nurses and other healthcare providers out there doing that for us every day. So to get a vaccine, for me, it's not a noble feat. It's just something that I did because I want to protect my kids, and I want to protect myself and my family and my patients. I travel because I train other doctors how to do surgeries, and I really want to protect myself when I'm flying. She had 2 DNCs done. Your periods aren't messed up because of the DNC. They're probably messed up because of your hormones, and so you probably need to have your hormones checked. I don't know what your ultrasounds look like. Maybe you have fibroids or whatever too, but that's a consult. If you want to dig deeper, you certainly can. And I'd be more than happy to consult if I had all your records and everything like that. Anything else about hormones, surgery, fibroids, anything about COVID, or dare I say the word? I talked to a lady today for a hormone consult who actually was hyperthyroid. Had a lady the other day that was hypothyroid. People are getting misdiagnosed all the time. I'm in a lot of groups on Facebook where, I hate to say it, but it's the blind leading the blind sometimes with some of these providers who, I'm doing my first Dutch test, and that's fine. You always have to do your first one. I did my first one about 8 years ago, but you can't learn how to do stuff by somebody telling you what to do. You have to learn by doing it. And part of the problem is if you don't do a lot of them, if you don't do a lot of blood tests, if you don't do a lot of Dutch tests, if you don't do a lot of hormonal management, you can't get good at it. I can't get good at men's health because I just don't do it. And I wouldn't want to do men's health because I can't get good at it. But there's a lot of people out there that, one, have a medical license and they're just trying new things, or two, don't even have a medical license. So really vet the people that you're seeing. Vet their intelligence, vet the amount of patients they've seen and their experience. Is it normal to get 2 periods in 1 month? If it's 1 time, 2 times, it's not horribly abnormal. Is it normal in the sense that everybody does it? No. but definitely something to call your doctor about. Is it also true that women under 50 go into menopause after 2 years of missed periods? No, menopause is not just a definition of how long you haven't had a period. Menopause is a definition made based on lab values, medical history, symptoms, and things like that. So you can't just tell somebody they are or not in menopause based on something like that. You could be suspicious, but to diagnose it outright is really difficult. I'm trying everything to go to Austin and get my surgery with you. Well, thank you. That's very kind. And I'd be more than happy to help if you can get out here. Can you start hormone therapy before you penetrate? Yes. There is no finish to perimenopause other than just flat out menopause. And there's absolutely no starting point or end point for hormonal management or menopause or perimenopause management. I have girls in their teenage years that are hormonally imbalanced for whatever reason, and I'm working with them on hormones and hormonal management. I want to find someone who knows what they are doing. I'm tired of getting prescribed metformin. Hey, that's tough. Metformin has a place in the therapy for PCOS and other disorders, but it's not the touchstone. It's not the ultimate therapy for those things. And for doctors that solely use it and don't look at hormones, don't look at FSH and LH, don't work on inflammation, don't work on diet, it's completely ridiculous. Completely ridiculous. If you're using metformin and you're also talking about diet and nutrition, exercise, supplements, if you're using it as a piece of an integrative therapeutic approach, then I can see the bonus of that. But to just solely use metformin for a person that has PCOS is lazy. And I say it all the time, it's lazy medicine. We talk about birth control pills for irregular periods, birth control pills for PCOS, for fibroids, for endo. It's lazy. We're not treating the problem. We're covering the problem up. And doctors are, sometimes busy and they just don't want to take the time because they've got 30 people delivering this month. And it's not good or bad. It's just time management. And really, in the overall scheme of things, PCOS, irregular periods, it's just not at the top of the food chain for, in getting invasive about it. They never talk about diet and such, and that's pretty common. And again, it's not good or bad. It's just, it's not thorough. But a lot of the times, thorough takes time. And if you look at functional medicine providers versus allopaths generally will take insurance. The downside to that is that we get probably 15 minutes. And we get, for a 15-minute visit, probably $65. You go to a functional medicine doctor, sure, they'll spend an hour with you, but they're going to charge you $500, and then they're going to charge you for ungodly amounts of tests. So you walk out of there spending close to probably $1,500, $2,000, and I don't know. I see a lot of people still having complaints that they don't feel any better. The amount of money you spend does not correlate with your outcomes, and unfortunately, that happens a lot. And there's this misconception that the more money you spend, the better the care is. And in most cases, the more initials you have behind your name, the less of an expert you actually are. I know that sounds egocentric, but the reality is, if you're putting all these meaningless initials behind your name that are because you went to these fairly meaningless trainings, it doesn't mean a whole lot. What means a lot is your experience, and you can't be an expert in something if you do 5 of them a month. It's just not going to happen. You wouldn't want somebody saying they're a robotic surgery expert if they've done 10 hysterectomies with the robot, but maybe 1,000 would make them an expert. And it's the same with hormonal management. These people that do 2 consults a week or 3 consults a week, then they go on Facebook and they're asking in these private groups questions because they don't know how to manage somebody. It's somewhat disturbing to me, and it happens all the time. So again, vet your providers, your coaches, your nurses. When they say they're experts, make sure they're really experts. How many patients have they seen? How did they learn? Where did they learn? How long have they been doing it? What were they initially trained in? I mean, it'd be like me if I came into your room and said, "Oh, I'm a functional emergency room physician because I took a course on CPR," or you actually have an ER doc that's been doing it for 20 years. Would you rather have them manage your heart attack or me? It's like, I'd freely admit I'd want to have them manage my heart. And it's just one of those things. You have to take that into consideration. So I know I'm just totally getting sidetracked. What do you think about doing a Dutch test for surgical menopause? You don't need a Dutch test if you're in surgical menopause, because I know your hormones are going to be almost zero. The only reason you would need the Dutch test, if you needed the Dutch test, would be to check your cortisol and your oats test, like your vitamin B levels, your melatonin and things like that. But if you're in surgical menopause, we know your estrogen and progesterone are going to be practically zero, and your testosterone levels are going to be drastically reduced. So I would say to go on hormone therapy first, possibly, if that's what you were looking at, and then maybe draw a Dutch test months later. What kind of test do I need to request for hormones? Well, here's my theory. Blood is very accurate. Serum blood testing for hormones is extremely accurate. The results come back in days. You can check all of the hormones. The only hormones you can't really check is cortisol, and you can't check metabolites of estrogen and things like that. The limitation with blood is that it's only a snapshot. So it only gives you your levels while the needle's in your arm. So that's a limitation. But the other beautiful thing with blood is that it's covered by insurance. And anybody that tells you that blood isn't accurate or that it's worthless is trying to get you to spend money, because it is very accurate and it works, and we've been using it for decades. You have to be good at the interpretation of the blood. You have to know when the hormones were taken. You have to know when the blood was used or drawn and things like that. So I would definitely say blood. Anytime you want to do blood, definitely do it. The Dutch test is also extremely accurate. It gives you a 24-hour window, so it's a much better test in the sense of time. It also checks hormones, but it won't check thyroid. It won't check vitamin D, so you still got to get blood for those anyways. It's expensive compared to, blood that's covered by insurance. It's about $350 to $450, depending on how much you're being gouged for the price. But it is an overall good test. And I would usually recommend people do Dutch probably at least once a year, just to kind of see. Or if I've been managing them hormonally and I can't quite get it right after one or two blood draws, then we'll maybe get a Dutch test. Saliva, other than for cortisol, and I will go on record as saying this, it's completely worthless. I think saliva is worthless. I always have. I have research to back that up. I don't think it's something that you need to do, and it's a waste of money. So I would do blood or urine. I would stay away from saliva. Any other questions before I bore people completely to tears here? We're talking about hormones. We're talking about fibroids, endometriosis, surgical interventions, Da Vinci, COVID vaccines, because I just got mine yesterday, and I had some lady tell me that she couldn't trust me anymore because I got the vaccine. I mean, what in the hell world do we live in where you're going to throw away somebody's experience that you used to like just because they got a stupid vaccine? I mean, seriously, how old are we, people? I mean, are we in kindergarten? What in the hell is going on with our country where you completely throw away somebody's perspective about life or their experience about things simply because they did one thing that you disagree with? I mean, Jesus, if we did that all day long, we'd never talk to anybody. When did we become so damn insensitive to other people that our perception of the world is the only thing that's right? Our perception. I mean, who are you? Who am I? I certainly don't know everything. Gosh, I don't know most about anything. I mean, ask the people around me. But I do know some stuff about Essure and I know some things about hormones every once in a while. But yeah, the last thing I want to say, go to Clubhouse. There's an app now called Clubhouse. You can get it at the App Store. It's free. And follow me, Shawn Tassone, MD, because Clubhouse is a really cool platform where you can listen to live discussions and you can ask live questions about topics. And I'm going to start talking with my friends. Probably going to start with Dr. Kringudis, Nat Kringudis, who's my best friend. And we're going to start having some hormone conversations over there. And it's completely free and it's live. And so it's really awesome. I love that you take the time to make these videos. Thank you. Oh, well, thank you very much. Maddie will be extremely excited to know that because she's bugging me all the time to make lives. And I bet you she didn't think I was going to do this one, but I did. Because I listen sometimes. I mean, I don't listen all the time. To my detriment, what I have done in my office is this. I have surrounded myself with really focused, really good integrator type people because I'm scattered at times. I'm kind of like the person that looks at the squirrel. And I'm not ADD because well, maybe I am, but I don't think so. But I think it's just, I've got a lot of ideas in my head. And so I have a wonderful staff, Maddie, Katie, and Michaela. And I'm still seeing people across the country for hormones or second opinions on Essure, endometriosis, or fibroids. And I'm taking insurance because I think that's why you're paying for the damn insurance is so you can use it. So let's use it. Don't pay $1,500 to get your thyroid evaluated by a chiropractor. And I don't mean any disrespect to chiropractors, but why would you see a chiropractor? You wouldn't come see me to have your back cracked. I hope not, because you probably won't walk out of the office. So why would you see a chiropractor for your hormones? See somebody like myself that's going to have 40 or 50,000 patient encounters that does the approach that you like as well. And if you don't like somebody's approach, obviously get a second opinion. But I just want to close on that. Get over to Clubhouse so we can have some awesome conversations. It's a great new app. It's free. And I'm going to sign off for now because the numbers are going down, which means people are getting bored. And I just wanted to say Happy New Year's Eve. Everybody stay safe and either get the COVID vaccine or don't. That's a personal choice. I got mine, and I'm going to keep posting about it and any side effects if I have any. Take care.